Good afternoon, everyone. Thank you for joining us for today's webinar, Behavioral Health Disorders and Employment for Justice-Involved Adolescents, hosted by the Transitions to Adulthood Center for Research at Mass Medical School. Our presenters today are Edward P. Mulvey and Carol A. Schubert. Before we get started, I'm just going to go over a few housekeeping items. Just so you know, this webinar is being recorded and will be available on the Transitions ACR's website probably within the next 2 weeks, along with a copy of the slides. If you have any handheld electronic devices, you may want to move them away from your computer and speakers. If you have any file sharing applications or streaming music or video open, we recommend you close that for right now. If you are experiencing any audio problems, you can check your settings in the Go to Webinar Audio tab in their dashboard. Also, if you are calling in over the phone, please use the unique audio pin that was included in your registration email. We will be having a live Q&A session after the presentation. If you have any questions for the Q&A session, you can type them into the questions tab as you think of them. You don't have to hold on to them till the end. And if you're having any technical difficulties, you can email me at deirdre.logan@umassmed.edu, or you can send the organizers a message through the questions tab. Please, could you move the slides forward? One more. These are our acknowledgements. The Transitions, that should say the Transitions ACR is a national effort that aims to improve the supports for youth and young adults ages 14 to 30 with serious mental health conditions to successfully complete their schooling and training and move into rewarding work lives. We're located at the University of Massachusetts Medical School in Worcester, Massachusetts, within the Department of Psychiatry and the Systems and Psychosocial Advances Research Center, or SPARC. And you can see our funders at the bottom, NIDLR, SAMHSA, Massachusetts CMH. And I'm going to just go a little over the presenters. Edward P. Mulvey is a professor of psychiatry at the University of Pittsburgh School of Medicine. He has directed numerous funded research studies on the link between mental illness and violence, the development of juveniles in the justice system, and the impact of sanctions and interventions for young people who have committed serious crimes. He also works with practitioners and policymakers on the provision of services to individuals at risk for involvement in violence. Dr. Mulvey currently serves on the Science Advisory Board for the Office of Justice Programs in the U.S. Department of Justice and the Pennsylvania Commission on Crime and Delinquency. Carol A. Schubert has an MPH and is a researcher for the Law and Psychiatry program at the University of Pittsburgh. She has coordinated several large-scale projects regarding the assessment of violence risk among mentally ill individuals, as well as factors related to the desistance from crime as serious adolescent offenders make the transition to adulthood. Her research focus has been on the provision of services to and experiences of youth in the juvenile justice system. And with that, I'm going to turn it over to our presenters. Thank you very much.
Thank you.
Thank you. This is Ed Mulvey, and I just want to thanks for the opportunity to be here today. And we want to share some findings from analyses we've been doing, and I think they're related to sort of where the research is at these days. So the first thing I want to run through just is kind of where the research is and where this fits in. There's been a good bit of research on justice-involved youth, and it's been stunning how many risk factors and problems they have. If you spend time with these kids, you see quickly how difficult their lives often are. 6 times more likely to have learning disabilities, and when you do structured instruments to look at psychiatric disorders, you find that somewhere they guess between 50 to 70% of them have a diagnosable psychiatric disorder, and that's well above the 9 to 21% of that level prevalence rate in a general adolescent population. There's going to be interruptions and deficits of skills, as they go through, and it's going to make it harder to get jobs. In other words, when you're out of the community and you're out of touch with people, like when you're in institutional placement and then you come back, you oftentimes have to start all over again, either in your schoolwork or in your vocational training or even, well, in your relationships with people in general, just your social capital. And you've also then got people with psychiatric disorders and this criminal history. You've got stigma and of the arrest, and it gets to be sort of a cumulative building process where one builds off the other, and you got kind of cumulative disadvantage. And that's the idea here, is that juvenile offenders with mental health disorders have a particular disadvantage. What's interesting is there's few studies that have looked at workforce participation for these adolescents and compared them at all to those without mental health disorders or with mental health disorders. Tom Grisso refers to these kids as being in double jeopardy, and I think that's a fairly accurate depiction. So what we want to talk about today are some results from the Pathways to Desistance study. And this is a large study, and I just want to give you some quick information about it. Basically, the idea is that the notion is that we know a lot about how adolescents oftentimes get into the juvenile system. We know a whole lot less about how they get out. So we've got a good bit of things about risk factors about kids when they're ramping up to offending, and yet we don't have much about what's really commonly observed ramping down into their mid-20s, so that many adolescents who are in serious trouble in their mid-adolescence are doing generally okay by their mid-20s. We don't know much about that. The word for it in the criminology literature is desistance, which obviously just means slowing down, stopping that sort of criminal offending. So this study is really aimed at trying to give us some information about that path out of involvement with the system. The idea really is to just get richer information. First of all, we need some description of what's going on in these kids' lives, and we know that involves a couple of things. One is adolescents grow up, they get less impulsive, they get broader views of the world. Things change normatively. People move out of their homes, they get different peer networks, they start romantic relationships, and because these adolescents aren't what one would call quote unquote in the normal path of life, they're also going to have systems involvement. They might be placed out of the community. They might be put on probation terms, et cetera. So all of these factors come together to make this a time of real transition and change. Now, if we can capture some of that information, the idea of this study is that you can improve some things about practice and policy, hopefully, in juvenile justice. You could do a better risk assessment, so you're putting resources into the adolescents who might need it the most. And for those adolescents who are almost going to naturally get out of this process, you might not have to put as much resources. So it'd be more targeted interventions and sanctions.
Okay, and thank you again. This is Carol. I'm going to just tell you a little bit about the study design. I think the important thing to note from what Ed just said is that the study was originally designed to understand more about juvenile offenders, broadly speaking. It was not designed as an education and employment study. So just want to let you guys know that from the outset so that you understand why we have things like we do when we talk about the study findings. Anyway, the study was done in 2 sites. We recruited youth in the juvenile system from Philadelphia and Phoenix, Arizona. We enrolled 1,354 felony offenders who were aged between 14 and 18 at the time of the offense that got them into the study. We included females and adult transfer cases, and that's important because typically speaking, a lot of the studies that deal with juvenile offenders are mostly males because females are less likely to go deep into the system. So we actually tried to get every single female that came through that met our criteria. And we also took kids that were transferred to the adult system. So most of the kids in the study stayed in the juvenile system, but for certain offenses, there's state laws that require them to be moved up to the adult system. So we took both of those types of cases. Once they were enrolled in the study, we did regular interviews with them for a period of 7 years. So we did an initial baseline interview that occurred right after they were found guilty of the charge that got them into the study. And then we did interviews every 6 months for 3 years and then every year following that up to 7 years. And those interviews I'll talk about in a minute. They just had a lot of information about background characteristics, mediators, family context, and I'll go into that in a minute. We also did what we call release interviews, which were when youth were placed in an institution in the criminal justice system or the juvenile justice system. We did an interview about that stay when they got out. We included information from what we call collateral reporters, who were their parents at baseline or a peer at follow-up, and we did those for the first 3 years of the study. And then we also did official records. We got court records and FBI records about offenses. So this slide here is just a broad overview of what was included in the interview. And as you can see, there's a lot of stuff in there. The most important thing is that it was about a 2-hour interview. What we do want to highlight is the things that just turned yellow, which was what's unique about this study. These are called monthly. We have data by month for all of these areas. And that's important because it allowed us to look at a number of things that's going to come up. Educational attainment, we could tell what month it occurred, and then we could look at what was happening in their employment after that point in time. There's a lot of ways that this monthly data became important. The other thing we should note here that's really relevant to this particular question is the information that we have about academic achievement and about employment. Here's just a very quick overview of what a monthly calendar looks like. And again, so it just basically, we have 1,354 subjects or study participants, so you can just imagine 1,354 rows. And for 84 months, we know where they live. We know that month whether they were in a facility or in the community. We know whether they were in school that month. We know whether they were employed that month. So we have a lot of information at that fine-grained level. Next, we're just going to give you an overview of who the kids are in the study. So the youth were age 16 on average when they came into the study, and they were mostly male, as for the reason I mentioned before. On average, they had 2 prior court appearances, meaning that they had 2 prior petitions to court. So it means that they had an arrest and it was processed in the court system. For 32% of them, they had no prior petition to court. So what got them into our study was the very first court petition that they had. And most of those youth were found guilty of a person crime. About 47% of the felonies that were involved in the study, or the folks that got into the study, were for a person crime, and these were things like aggravated assault, attempted murder, that sort of thing. It was also ethnically diverse. That was by design. We worked very hard to get 2 cities where we would have a sample that was not all one ethnicity or the other. So the study ended up being 29% Latino, 44% African American, 25% Caucasian, and then 2% other. Also, what's important for you to understand before we get into the findings is what we meant by a mental health disorder and how we assess that. So at the baseline interview, part of the interview battery included the administration of the CD, which is a comprehensive and fully structured clinical assessment of psychiatric disorders. If a person were to do the full CD, it would take several hours, and we just could not do that much time with these youth. So what we did focus on were the disorders that are most common among youth in the juvenile system, and those are the only ones that we assessed. So these major depression, dysthymia, mania, PTSD, ADHD, and drug and alcohol abuse and dependence were assessed through the CD. The first 5 disorders listed there are what we are calling mood and anxiety disorders, and then obviously alcohol and drug abuse and dependence is a substance use disorder. We also assessed the ADHD in a little different way. Everything other than ADHD was assessed using the CD. The ADHD scale was assessed from parent report, and it was based on the disruptive behavioral disorders scale. So I think the important thing that we want to mention here is that we did not measure every single diagnosis that was possible. And so when we say a person has a mental health disorder, it's referring to this subset of disorders that we assessed. Okay. All right. So moving into the meat of the presentation here, the first question we asked was just, do youth with mental health problems in the juvenile system have different risk factors as well as education and employment outcomes compared to youth in the system who don't have a mental health disorder? So this is just a simple comparison. So the first slide here is just basically pointing out the prevalence of the disorders that we measured. So you can see that the 56% of the youth met none of the disorders, the criteria for none of the disorders that we mentioned. And then mood disorders is 8%, 27 or 28% for substance use, and then 9% were comorbid, had both a mood disorder and a substance use disorder. We then looked at the characteristics of the youth by disorder group. And just want to note here, there's not really a lot of difference in age. Gender, you can see that the mood anxiety disorders are more females than they are males. I mean, it's 70% male as opposed to some of the other disorders which have a lower percent of females. The majority are minority, and it's about 50-50 on most of the disorders across the site. So this is just the percent that were from Arizona. So 58% of the Arizona cases had a disorder of some type. And, you know, you can see 59% of them had substance use. All right, so this is just to give you a sense. From this point forward, though, we're just going to split this out to the any disorder or no disorder because it just gets too complicated. So, again, we're looking at the potential barriers to education and employment. If you just look at it by any disorder versus no disorder, there seems the youth with a behavioral health disorder of some type had more prior petitions to court. They were slightly younger at the age of first prior, but that's probably not significantly different or meaningfully different. Over the subsequent 7 years, a higher percent of them were rearrested, and they had more rearrests than the no disorder group. Some other things, the any disorder group were from neighborhoods that were slightly less disadvantaged than the others. There's a lower mean score, but they went on to have more placements in and out of facilities, mostly the juvenile justice system. They were more likely to be homeless at some point in that subsequent 7 years, and they moved around a lot more than the youth with no disorder. This slide here just is giving you a picture of just one kid's movement in and out of facilities during the time in the study. So I don't know if you can see here, but the first, when the youth came into the study, this was a 15-year-old from Philadelphia. He was in the juvenile system, then he went out and was in the community, then he was back in a facility, then he was in the community, then he was back in a facility, then he was in a treatment facility, then he was back in the juvenile system, back in the community, then he went into the adult system as he got a little bit older, and then he was out of the adult system. And we put this there mostly to just demonstrate that the kids in these systems are really moving in and out of their community a good deal. And I think it doesn't take too much imagination to figure out that that's really going to be have an impact on your ability to maintain a strong education, strong connections in the family, and employment. You're going to potentially be losing jobs as you go in and out of those placements. Just a few more descriptive things. The any disorder group was more likely to be suspended or expelled. They had a slightly higher IQ, but it's important to notice that both groups are below average. Kids in the juvenile justice system, generally, the IQs are lower than the norm. These folks were in slightly fewer distinct schools, community schools, not placement schools. And the very most important thing here that we want to point out is that fewer of them had post-secondary education or even completed a high school diploma. And that became very important in our work moving forward. And then I think the last slide I want to mention about these descriptives is just going forward over at baseline. More of the folks with a disorder had some kind of work experience, but you can see a lot of them, nearly double, were fired in their history. And then going forward, they had more job instability than the no disorder folks. Okay. So basically what we just wanted to show there, that youth in the juvenile system with or without a mental health disorder have multiple risk factors that can be related to education and employment outcomes. Okay? This next slide is just to give you a picture of how their involvement with gainful activity. And this kind of switches the outcome for a minute, because earlier we would talk about education and employment independently. This gainful activity variable is an indicator that it's a month when a youth was going to school without missing more than 5 days, or they were working at least part-time. And the reason we moved to this variable to display these patterns is because as kids get older, it's to be expected that they don't continue education. At the point they get their GED, you wouldn't expect them to be continuing in school. You might think that they should be moving into the work environment at that point. Other kids will be in the school if they were younger when they came into the study, they would be in school longer. So we moved to this thing that gave them kind of credit for productive activity if they were doing either thing. And the major point that we wanted to show here is that just that the patterns, whether the individual has a disorder or not, the kind of patterns of staying employed or being in school are very similar for both groups. There's not a noticeably different. There's a group in both that kind of declines over time. There's a group that stays high. There's a group that stays low. It starts low and goes up. And then there's another group that's pretty low the entire time. So I think that was all we really wanted to demonstrate with that slide. And then, so the idea here is that the overall patterns of employment education appeared to be the same in adolescent offenders with and without a disorder. Okay. And then we moved on to doing some group comparisons of things that occurred over the 7-year period. And again, I don't want to spend too much time on this because I think we make the point, but the things that just turned yellow, the number of distinct jobs in the employment column and the education things, these are the ones that were significantly different over time for the disorder group versus the no disorder group. So basically this is saying that the mental health disorder group was more likely to receive a GED as compared to the no disorder group, while the no disorder group was more likely to have a high school diploma. And there were not group differences in the proportion getting a license or attending school. So I'm sorry, I think I kind of just reviewed this thing here. Sorry, I flipped there. I went a little bit further ahead there. So the other things were significantly different, and then this is the point that's showing their differences. And that really struck us because in our minds, having a certain level of education makes a difference in your job opportunities going forward. So it was very important for us to control for this factor as we were going forward in our analysis. All right.
Great. So I'm going to move on to the next question, and that I think Carol laid the groundwork that basically the adolescents with mental health disorders also have a whole lot of other risk factors that are related to later offending and are strikes that they have to carry around with them in terms of education and employment. What was interesting to us was this big educational difference that so many of the adolescents with mental health problems were not getting their high school diplomas, but were getting GEDs instead. And so we then started to think about, well, does the mental health status, is that keeping them from getting better employment outcomes over and above that educational achievement? All right. So here's what we're doing. We're basically saying, okay, does having a more than minimal education, having more than a GED, really help you get a better job? Does it help you go to work more? And does it help you earn more money over the rest of the time period after you get that high school diploma or vocational certificate. We know that it's less likely if you have a mental health problem. So we're saying, well, does that really matter? And the issue is, you got to say, well, you know, they don't hand these things out at random. There's a whole group of kids who somehow managed to finish high school or managed to go to vocational training. And so you've got to kind of control for the characteristics of the adolescent that might predict whether they get any sort of high school diploma or any sort of vocational certification. So the first thing you do is we generate what's called a propensity score, taking all these background characteristics. We've got a load of background characteristics. So we take 51 background characteristics from those interviews at the baseline interview, and you do a prediction equation for each individual about how likely are they to get a high school diploma or a vocational certificate. And, you know, so what you're doing is predicting that factor. And that allows you to kind of separate out the effect for actually getting one versus just looking like a kid who would have one, all right? So you're taking out all that variability that's related to the propensity of that individual to gain that certification. And this just shows that, I'm not going to go into the ROC curve, but it basically just says this is pretty good, performance. You measure the amount of area under the curve. That's what that AUC stands for. The green line in the middle is chance. If we were just flipping coins, that's how well we'd be doing. And the curve shows that how well this equation does. So then what you do is once you get this propensity score and it's suitable and it works like that one does, you do these regressions. Negative binomial, I'm sure nobody's terribly interested. I'd be glad to talk to them about negative binomials if they'd like. But anyway, you get a regression analysis, which basically says you're going to see how well that academic achievement predicts outcomes, employment outcomes, accounting for that propensity to get that certification in the middle. I mean, in the first place. And you look at two employment outcomes over the follow-up period. We're going to look at wages, how much money they made, and how many weeks they worked. Did they have a job very steadily, and did they make any money? So what do you find out when you run those analyses? When you look at wages, that's really predicted by academic achievement, even after you control for that probability of that adolescent to have gotten that certification. And there's no interaction with the disorder status, meaning it works the same whether the person has a mental health problem or doesn't have a mental health problem. In both groups, that's called moderation. In other words, you might see, wow, if kids with a mental health problem got that certification, it would really change it. It changes it the same amount whether or not the person has a mental health problem. Then you look at the outcome of total weeks worked, and again, it's predicted by academic achievement pretty highly, even when you control for that predicted probability for getting the certification. And again, there's no interaction with disorder status. So the effect operates the same in both groups, and it operates positively in both groups, even when you account for background characteristics. That leads us to having a mental disorder, health disorder wasn't independently linked to poor employment outcomes. It wasn't the disorder. Educational achievement carries all the weight, okay? The disorder isn't doing it, it's the educational achievement. So where are we going? We've been going through 8 million things with you pretty quickly. So where are we at? Obtaining a GED has no effect on employment outcomes, okay? Meaning that once you get the GED in and of itself doesn't amp it up. High school diploma and a vocational certification amps it up. The effect of more than minimal education is equally positive for justice-involved youth with and without a mental disorder, okay? You're getting something beyond the GED helps both groups equally. Youth with a mental health disorder are less likely to have more than a minimal education. It's more likely to have them, quote unquote, settle for a GED. And efforts should be made to promote educational achievement beyond a GED, particularly with youth with a mental disorder. It will help them, and they're less likely, because of the mental health disorder and probably this instability of school attendance and everything else, to get it. But it's an important differential in these adolescents in the next several years of their entry into early adulthood. Okay? So that was the first point we wanted to make. Third question. Now, that's okay, so we see the effect of that. Third question is, for youth with mental health problems in the justice system, what's the role of mental health status on employment? In other words, status changes for adolescents over time. So, you know, we're talking about these disruptions. So do symptoms negatively affect employment, or does employment negatively affect symptoms? All right. Now, for this, I'm going to show you these quickly. This is the youth who met diagnostic criteria for mental health disorder, substance use disorder, co-occurring again. It's basically the same group. All right, this is the same stuff you saw before, basically. Okay. What I want to show you is the measures over time. Now, what I'm saying is, at time 1, what's the employment outcome look like at time 2, and what's the difference in mental health status? In other words, sort of symptom level at time 1 to time 2. So that means we have to measure mental health symptoms. We measured these every 6 months over the first 3 years, and that's what we were looking at. So it's unrealistic to say if your symptoms were bad a year ago, how are you doing in your job now? But it's not real unrealistic to say if your symptoms were getting worse and you were pretty badly off in terms of symptomatology 6 months ago, how do you look now in your employment? Has it affected it? So we used a brief symptom inventory, which is a pretty widely used measure of symptomatology. 53 items, self-report, and there's one scale on it called the Global Severity Index, which is kind of the summative score, which is probably the best indicator of overall symptomatology. For employment, we go back to those life event calendars, and we look at whether somebody worked, how much they worked during that particular next 6-month period. And we looked at weeks worked, wages earned, and then we just split it about whether they worked at all and whether they made any money at all. Okay, so we just got to a 0-1 sort of split. So these are the variables we're going to look at over time. Now, people did change over time. I just want to show you this, that mean symptom score did change across these waves, all right, of individuals. And the percent of youth employed in each wave changed as might be expected. So there is some change going on here. Now, the way you test this, and I'm going to put the picture up here, this might throw you a little bit, but we're going to walk through it, okay? This is called a cross-lag panel model. In other words, you've got across all of those time periods, from period 1 to period 2, 2 to 3, 3 to 4, 3 to 4, you've got the same thing going on. You've got symptoms at the first time period called T, and you've got right up here, and you've got employment at time T. We know they're related. We've also got mental health symptoms at T+1 at the next time period, and employment outcome at the next time period. The adolescent's age at time T, the adolescent's age at time T+1. So this, and then you got the symptoms either affecting employment or employment affecting symptoms. So let's think of what changes over time here. The first thing are these factors. We know that symptoms at one point are going to affect symptoms at the next point. People who were high on symptoms at one time tend to be high on symptoms the next time. And we know that if you're employed at one time, you're probably more likely to be employed the next time. That's called an autoregressive effect, okay? It's on itself. Symptoms on symptoms, employment on employment from time to time, okay? The next thing we're looking at is a concurrent effect. Now, what we're saying here is, hey, if my symptoms are really bad, the odds of me being employed at any given time that my symptoms are bad is probably related. And at the next time, that's probably the same thing. If my symptoms are 1 point the next time, my odds of being employed at that time are also related somehow. So that's a concurrent association. The cross lags are these two red arrows here. In other words, if your symptoms at the first time, does that affect what your employment's like at the next time? Or does your employment at the first time affect how your symptoms are? And the employment at the next time affecting your symptoms, there's a good bit of literature in the adult area that having a job tends to affect symptoms positively, meaning it tends to reduce symptoms. The question is that true for these adolescents? Okay? And we're going to account for age at each time because we just looked and knew that over time as adolescents age, there's going to be some higher or lower likelihood of either your symptoms going down or your likelihood of employment going up, okay? So the idea here is we're going to have a model that takes all of these into account. So when we look at these cross lags, does employment affect symptoms or does symptoms affect employment? we're controlling for those autoregressive and concurrent effects and age effects. What you do in this way is you get a model in your head like this. You say, this is how it might work. Then you take that model and you fit it to the data. You take the existing data and you say, does this all work out this way more than you would expect by chance? And that's what you're doing. You're trying to see, does that model, if you put it on the existing data, does it all look like mishmash and it's all chance? Or does it follow this pattern? And if it does, those are going to be significant effects for some of those pathways. Okay. So what do we get when we do that? Okay. This is the output, and I'm going to walk through in each time. Okay. First, let's look at the top. Autoregressive estimates. You remember those? Okay. That's symptoms to symptoms, employment to employment. Okay. They're pretty high. Those are really weighted very heavily. Okay, for weeks work, for wages, for dichotomized weeks work, and for dichotomized wages. So the dichotomized is just were you working at all, and did you make any money at all? So yeah, they're effective. That makes a good bit of sense, right? So what does that show us? It means that symptoms level and employment outcomes change some, but not a great deal from one 6-month recall period to the next one. If you're high on one recall period, you're likely to be high on the next recall period. Now remember, we're controlling for everything else when we look at these too. So now let's go and look at concurrent associations down here, meaning employment at one time to the GSI at one time. These aren't significant at all. So that somebody's symptom level doesn't seem to be concurrently related to their current employment status. So it's not doing a whole lot in terms of at the same time. They're not highly related, all right? Conclusion, symptom level and employment outcomes aren't highly related within any given recall period. All right, remember those arrows from each time. The third one is the one we were really interested in, and that's the employment at time one. These are those cross lags, those X ones in the middle. Employment at time one to symptoms at the next time. Your symptoms at time T to your employment at the next time. Is employment driving symptoms or symptoms driving employment? Well, what you see are these significant effects with the symptoms driving your employment status the next time. And this is controlling for all that other stuff we have in that drawing, right? So where are we at with that? Employment measures aren't significantly related to symptom level in the next recall period, but symptom levels are significantly related to employment outcomes in the next period. Less symptoms, better employment outcomes, okay? Now, before we get to kind of trying to wrap a lot of this up, the study limitations, let's keep these in mind as we start trying to figure out what this all means. One, this isn't a highly generalizable sample. You know, Carol laid out all of who these adolescents are. They've all been brought in on felony offenses. They're from 2 major metropolitan areas, et cetera, et cetera. Yet, these are people who need help in services, and these are people who are going to have lifelong problems adjusting if they don't get out of this late adolescent, early adulthood period. And so while it's not generalizable, it's really a relevant sample for programming thinking and for policy thinking. The other thing is, as Carol mentioned, this is kind of a delimited group of what we call mental health. Different clinical profiles or diagnoses may show distinct patterns of effects. Once again, though, these are the ones that are pretty predominant in the groups. If you say, oh, I'm going to go work with somebody with a mental health problem in juvenile justice, you're likely to see the types of mental health problems we're looking at here. Oh, you might find people with psychotic disorders, but they're going to be higher than the population in general, but it's still going to be a real small proportion of the hundreds of thousands of kids we process through these systems. Other aspects of working might be important to examine. Then, we only looked at like how much you made and how much you worked. Now, there's a lot of things like sense of belonging that are important outcomes that we didn't look at. So we're looking at pretty bare bones outcomes and pretty measurable sorts of things about employment. There might be other dynamics going on in here about having a job that really matter. And again, we didn't look at treatment. The mental health or substance use treatment isn't really considered. I'll admit we've done preliminary analyses and not in great depth, and we can't find a strong effect for treatment, but a lot of that has to do with a lot of these adolescents end up not getting treatment. They're not exactly the most sought after clients for many services, okay? So the implications of where we are at this point, you can take the limitations into effect, and that's fine, but I think the using a design that looks at change within an individual is a very strong design, because it eliminates all that kind of group stuff where one group is real high on this and low on that. This is within a person. When this person goes up, does that go down? When this person goes down, does that go up? And it's all within that person's baseline from the beginning. So where are we at? The justice-involved youth with mental health problems are high risk for negative outcomes, okay? They have as high or a higher level of risk for poor outcomes. And I think Carol was showing that really clearly as you went through those initial descriptive tables. Second, though, they follow a similar behavioral pattern of gainful activity. There's the same proportion of them kind of stay really positively active or start positively active and get worse as time goes on. Some get better as time goes on. So it was interesting when you take each group out and you try to say, what are the patterns in here? You get two graphs that look almost exactly the same. There's the groups break out pretty similarly. What doesn't happen is that the adolescents with mental health problems are less likely to get a high school diploma or post-secondary education. And that just kind of sticks out when you look at those comparisons. Okay. Second thing is, having more than a minimal education matters equally if you get it. If you're in the mental health group and you get it, it matters just as much as if you're not in the mental health group and get it, okay? And it improves the chances for a positive outcome in the next several years. And then when we look at the effect of symptoms and employment, the results seen in the adult literature, having a job for a longer time period, making more money, doesn't seem to affect symptoms in these youth in this time period of their lives. Employment doesn't appear to create a harmful stress or reduce symptoms. So if people say, well, if he can just get a job, everything will be all right. I don't know that that's always true in these adolescents. I think it's an important component of what happens, but based on these results, I don't know that it's going to really reduce their mental health status. Symptoms, however, do affect employment outcomes. So as your symptoms go up, your employment outcomes are worse off. So some supportive employment with regular access to mental health services could have a positive impact on this group of adolescents. So when everybody's saying, well, don't worry about the symptoms, maybe he just needs a job, or somebody says, well, we got to get their mental health situation under control and support it, and we got to check up on the mental health system involvement when he gets out and is working, is much more, that latter statement is probably much closer to what we see in the data. Some sort of supportive employment makes a lot of sense. Working isn't going to make those symptoms worse, but it's not going to make them any better either. And if those symptoms do get worse, the likelihood of that churning, of losing a job, and the next thing you know, a year and a half, you got a lousy employment record built up when you're looking for your fifth or sixth job. So some supportive stuff around mental health care does seem to matter a lot in this group. Okay? Those are the findings we have that we want to share with people. And we just want to bring your attention to the fact that there's a website out here. We're showing the cover page of it and the address at the bottom. This details the study and the number of publications that our collaborators and ourselves have put out on this data set and this study in particular. There's a lot of stuff interesting here. If you want some information or some things, you can get in touch with us and we can send you the articles. There's a section in here on publications. You might see some that are of interest and you might want to try to get hold of them. The other thing I want to mention is that we're showing here the screenshot for the spot where the data are. We've taken all the data from this. This is 23,000 or something interviews over how many years, Carol? I don't know, long time.
About 10 years.
10 or 12 years of interviewing people. And those are archived at the University of Michigan at a place called ICPSR, which is Inter-University Consortium for Political and Social Research. You can go in and access these data, pull them out, and do analyses for yourself if you have any interest in looking that stuff up. So be aware the data are available and guidance about what's in the data are available. The data are at Michigan at ICPSR, and the guidance about what's in there is on that website I showed earlier for the Pathways study. Also, I'll show you our contact information. If you have follow-up questions or interest, we'd be more than happy to answer any inquiries. I always put Carol first on that list for answering any inquiries, which is very nice of me, I thought. But anyway, but anyway, that's who we are. And I know we gave you a lot of stuff very quickly, so we'll open it up for any sort of questions or inquiry or anything like that.
Thank you so much for that very informative presentation. We do have a couple questions that have come in. They may kind of go together, so I'm going to read them at the same time. The first is asking, is it a waste of time to encourage these youth and young adults to get a GED? And then he was also asking or saying that the system effect on employment is very weak, isn't it?
I'm sorry, the system what?
Symptom effect on employment is very weak, isn't it?
Yeah, the path is not real. The path is not real big. It's more than you would expect by chance, but I agree. It's not like if symptoms go up a little bit, employment outcomes are going to be greatly affected. I can't remember exactly how we've characterized that in terms of. That's one of the reasons we split it to a dichotomous outcome to try to get kind of what an odds ratio would be, which is more readily understandable. And I just I don't have that figure at my hands, but I think that's an accurate interpretation. I think the demonstration was just more that it matters beyond what you might expect. The first part.
Yeah, I think the question there had been whether that you should encourage them to get a GED, and I think the answer is that it's better to have a GED than nothing. But but it should not be the ultimate goal, because getting some other kind of training, even if it's vocational training or some other post-secondary or post-GED training, is even better. So if you're kind of ranking it, having nothing is the worst, having GED is next worst, getting something other than either of those two is the best case scenario. And sometimes, juvenile settings that we've been exposed to might do a little bit of too much of emphasizing just get the GED. And I think our message would be, let's encourage these kids to go for more than that to the degree possible.
And there's a lot of literature coming out now about sort of long-term earning effects from having a GED, and it's coming out very similar to this sample. In other words, when you look at like broader high school samples, you're still not seeing much of an earning effect for kids. If you're just looking at that outcome. Now, there may be other things like sense of accomplishment, if that can be built on, and somebody starts to look for a job as a result of having one where they wouldn't look for a job before. Those things all matter, and I think it's silly to say something that never matters or never helps, because there's a lot of ways something can help and matter. But at the macro level, when you just look at is this person likely to earn a lot more money or have a much better job as a result of it? Pretty much all the literature is saying, no, it doesn't really change the odds of that very much. But the way the question was, is it a waste of time or is it? No, I don't think so. But let's not think it's the be all and end all of everything either.
This is Dee asking, when you talk about a GED, you're using that as a general term also for now the high school, I think it's equivalency or something?
Yes, the high school equivalency, because the high school diploma would be more than just the GED.
You've got to attend a certified high school setting. The GED, you have to take the test and show a minimal level of proficiency. And actually, that's one of the reasons they think that there's that difference, is that a lot of kind of socio-cultural learning and kind of social skills and connecting with people and everything happens when you go to school. And oftentimes you get a GED by studying in a group of 2 or 3 or 4 people, and you all study and then you all take it on the same time. So there's a social component of learning that is usually missing.
Hi, Ed and Carol. It's Mary Ann Davis. And thanks so much for this great presentation. There, as you say, there's like, I think, Ed, you described it as like a million points to take away from this. In trying to sort of think about what folks might generalize from this, specifically in regards to this population, so not generalizing to young people who aren't seriously involved with the justice system, but just within this population. You know, on the one hand, one could say, it's not the mental health per se that is challenging them for employment, but their lack of a more than minimal education coming out of the first set of questions. But then on the second set of questions, like, but there is something about mental health that is having an effect on their future employment. Can you sort of weave those two pieces together for us?
I would think the major point of the first thing was all these other risk factors that are present in the lives of these kids that are beyond mental health. And then they indeed might overshadow the mental health per se. So I think a very important thing is that these kids are not, they've got a lot of barriers or battles to be overcome as they move forward in education or employment. That would just, go ahead, Ed.
Yeah, and I think that is it. I don't want to get off on this too much, but oftentimes we think about adolescents in the juvenile justice system, and we think, well, there's the bad kids and there's the mad kids, you know? I mean, and these adolescents who are there with mental health problems are somehow a totally different, socially contextualized group of people. And that's not really the case when you look at the data, that they, as Carol says, they have a whole lot of other barriers, like amount of placements out of the home and, you know, co-occurring substance use problems and everything else. So that they've got a lot of risk factors for crime and a lot of barriers for future success. And I think that's the point of the first sort of take on this. The other point is that people change over time. So we can put them in a box as having a mental disorder or not having a mental disorder, and you can find those don't clearly break this according to mental health problems. But someone with a mental health problem, those second set of analyses are really done just on adolescents with mental health problems. They change over time. Sometimes they're more symptomatic than not symptomatic. You can't ignore the mental health problem because it does have an impact, but it doesn't define that person as a distinctly different person in juvenile justice who can only go one way and is going to come out fine. That's not true. And in fact, they're carrying a lot more baggage than a lot of the adolescents without mental health problems, and probably deserve increased service attention rather than it'll all be okay, don't worry about it. Does that make any sense, Marianne? Maybe not.
Yeah, that's very helpful. Thank you.
We could, I see a question came up about how we could get a copy of the presentation. We'd be happy to send this to Mary Ann's group and they can distribute it.
Yep, we'll be, if you send it to me, we'll be posting it along with a copy of the recording of the webinar on the Transitions to Adulthood Center for Research's website. And it should be up within the next 2 weeks. So you'll be able to go there. I think Allie just sent out a note with the website address where you'll be able to find it, and it'll be in the follow-up email that'll go out in a couple of weeks as well.
Okay.
If anyone has any further questions, feel free to type them in. We have a couple more minutes. While we're waiting, I'm just going to give a plug. We have some more upcoming webinars in May. One featuring Michelle Moen, that'll be hosted again by the Transitions ACR, and she's on May 31st. And then we'll have another one with Kate Puvarva, I think on May 16th, that'll be hosted by Spark itself. And if you want to find out more about these, you can go to our website, and you can register for there. You can join our listserv so that you'll be in the know about any upcoming webinars or new publications we have. And nothing else has come in. Oh, there's one. Having a mental health issue does seem to make you less employable. Is that a correct summary?
I think it makes your employment, what we've seen is the stability of employment is harder. So people with this, mental health problems seem to have more times being fired or churning more jobs than people without the disorder. So I think it's a more unstable lifestyle in terms of employment and living and a lot of factors than is common. And I think employment's one of those that's less stable. Yeah. And again, we're talking about compared to adolescents who are pretty much at the deeper end of the justice system.
Yeah, I just would like to add to that. If we go back to those original tables way at the beginning, which I know are hard to keep everything in mind, but those kids with mental health disorders also have less stable addresses. They also have more placements. They get more some neighborhood. All the kids have neighborhood disadvantage issues. So it may not be the mental health disorder per se. It could be just that all the other things coupled with the mental health problem could be making it appear as if they're less employable, but it's really, we don't know which of those things is driving the fact that they could get a job or not.
Do you know if any of the young adults in your study went on to use any supported education or vocational services, or were eligible for it, and if that made a difference in their employability or their employment trajectory?
We actually don't have good information on whether they had supported education or not, or supported employment. The way the questions, because that wasn't an original goal of the study, there weren't real refined questions about that. We do have a sense of which kids got vocational training at some point, because that's a question that we asked independent of, the services they got in facilities. But once we knew they had it, we didn't get a lot about the qualifying information that went along with it. So we would not be able to answer that question that you just asked.
And that's true about a lot of different types of services. I mean, we found it very difficult to really get at things like dosage and duration of services and quality of the services you received. And I think if anybody's worked in this area, there's a vast heterogeneity in the way some services are offered. And so we have some stuff about institutional care and institutional climates from those release interviews, but outside of the depiction, the adolescents report of what happened when they were in placement, all the other sorts of supportive environments, as Carol says, we just don't have good data on that.
Carol and Ed, it's Mary Ann again. I had one more question in thinking about the last question that came up from the audience around sort of the unique contribution of mental health per se. I think your point is extremely important when you think about the services that this population might be accessing, that if you're a provider working with a young person who's been referred to you for mental health treatment, who's been involved with the justice system, that one of the things you would be important for you to be aware of is that in terms of these other difficulties in their lives, they're likely to be more challenged than even other young people who've been involved with the justice system who don't have mental health. So it comes as sort of part and parcel of the package. I think is probably an important point for providers to be thinking about, and perhaps in terms of policy or the way that we set up our systems.
Yeah.
Yes.
And I think the lesson that providers and the broader community has learned over the years is people aren't their disorders, And I think with these adolescents at this time, when you're really kind of building social capital and you're starting to get
onto employment or starting to try to make something of your life. And that's gonna lay the groundwork for where you are 10 years from now. It's really important to understand that they have a broad range of needs that are probably pretty substantial beyond whatever particular diagnosis or disorder or that walks in the door with them.
Yes, it really argues for really well-coordinated, comprehensive supports for them.
Exactly.
Yeah.
Yep.
Yep. An important conversation too as the field moves towards thinking about how do we work with adults, young adults in the criminal justice system. I think a lot of these findings have implications for that conversation as well.
Absolutely.
Yes.
Absolutely. Yep.
All right.
Okay.
Well, it's 2 o'clock. I again want to thank you both so much for your wonderful presentation. We really appreciate it. Again, these slides and the webinar itself will be posted on the Transitions ACR's website. And to that, have a great day, everyone.
Thank you very much. Bye.
Bye-bye.